This
that
conference will now be recorded.
we have heard enough and more about this coronavirus and where it did come from, what is it happening, and enough and more on the social network and media. So I'm going to briefly start with some of the questions which my patients have been asking or expressing their concern in the last few days. Being a primary care doctor, I deal with them every day. So let me summarize about very few questions what they have been asking from me on the last few days. We'll start from there, then we dedicate most of the time for question and answers for you. So the first one everybody is asking is among the frequently asked question is, when will this end? It's a difficult question, and all the time patients have been asking me, what will be May bring to us, or June bring to us, or will it go into the summer? Well, we don't know, right? It all depends on how well the virus is contained. So my personal opinion on these things are, we have to achieve four goals for this. Number one, the hospitals in the state must be able to safely treat all the patients who need hospital admission without going into the crisis mode. Number two, the state needs to be and the third one, they should be able to track this contact. That is the contact tracking one. And finally, we should be able to see reduction in the number of cases over the last 14 days without any admissions or new cases. If we can achieve this all, then we can look into reopening or when are we coming to the end. Hello?
Could I interfere for a quick second, please?
Yes.
I'm going to mute everyone, and then I'll unmute you so that we can have a clear audio session on this call. So let me mute everybody, and then I'll unmute you, Raghunath. Which caller are you on the line? Which number?
It is 638-6729. 410-638-6729.
Caller 26 is the doctor.
All right, great. So let me mute all. Raghunath?
Yes, I'm here. I'm able to hear you. Do you want me to start from the beginning?
No, I think we heard at least the first portion of it.
That's fine. Okay, so let's move on. Yeah. So sorry for the short interruption. We are going to continue that. So the second question everybody is asking is, how can I help? The simple question is, stay home, obey the orders or the regulations and the restrictions which have been put on us by the governor of Maryland since we live here. And the third one is, what should I do if I feel sick? So if you have the major symptoms of COVID-19, we all know that by now, heavy fever, coughing, sore throat and all, call your family doctor. Your family doctor is the only person who can help you to be tested. So contact your family doctor if you feel that you need some help. Then finally, there's a question about, should I wear a mask? Well, in the beginning, everybody thought that we don't need that, partly because of we thought that to give the medical grade mask for the healthcare workers who are desperately in need of them, and at that time it was short in supply. But now, living in Maryland, it is recommended to have a facial clothing, either mask or bandana or whatever it is, right? We all know that now. The next question commonly people ask is, doctor, how do I get tested? And again, this can be only ordered by your healthcare provider. So explain your symptoms to your doctor, not to be in the fear, but just explain to him, only your doctor can arrange the testing to be done. Next one, how does the coronavirus spread? We all know that is by the droplets. Then another question commonly comes is, when is the vaccine coming in? Unfortunately, it is not that easy to produce a vaccine. It might take about, at least in my opinion, 12 to 18 months. But there are some encouraging news which we'll talk about it as we move on. A company in England, especially from Oxford University, might be able to come out with something positive by September, October. So that is a very positive encouragement for us. Then finally, what makes this outbreak so different? As you all know that it can be similar to flu, but on the other hand, it's not lethal as flu as well. So you have to be very, very careful, and you have to take all the maximum precautions. Not to be panicky, not to live in fear, but simply the basic precautions. Wash your hands, wear a mask. These are the two basic things. And finally, of course, again, staying home. Another question people ask is this, doctor, if somebody is suspected and if you put them on isolation or quarantine, what do I do? Well, if there is a space, the sick family member should stay in a separate room and use a separate bathroom. If masks are available, both the sick person and the caregiver should wear them. And when the caregiver enters the room, it is very important to wear that. Make sure not to share any dishes or other household items to regularly clean and surface like counters, doorknobs, toilets, and tables. Finally, don't forget to wash your hands frequently. Then another question not related to medicine, but all the time patient asks me, doctor, do I have to stock the groceries? Well, plan for 2 weeks of meals if possible, but people should not hoard food or supplies. Despite the empty shelves, what you see in Costco or Giant or any other groceries, the supply chains remain strong. So just use your common sense. I will stop here and then we'll move on. I will allow the moderator to take the questions. We will answer the questions one by one.
Great, thank you, Raghunath. Can you hear me?
Yes, I am able to hear you well.
Perfect. So I also sent a message on the chat box on GoToMeeting asking if anyone has any questions. I haven't seen anything. So what I'll do is at this moment, I'm going to unmute all and if you could kindly speak one after the other if you have questions. That way we would be able to listen carefully and answer them. If somebody is already asking a question, please kindly wait till his question is answered so that way everyone's questions can be taken and answered. Thank you. Was that a question? Anyone has a question based on what you have heard?
Hi, Dr. Raghu.
Yes, hello.
Hi, this is Bindu and Anu from Canada. How are you?
Oh, hi, it's a familiar voice. Go ahead.
So far, so good. So the question that I have is, I normally don't go out for groceries. I always try to do as much as possible through online. And once I get the groceries, should I worry about getting any virus along with the groceries? I do some cleanups, like wipe down everything, try to wash as much as possible, use washable, but I still have some doubts in mind. Should I not do any groceries at least like for a while? Or I'm not sure. That's why I'm kind of curious to know what is the best practice.
Sure. It's a very good question and a useful question I think for everybody. So number one, when you buy anything in the grocery, yes.
If you don't mind, just summarizing the question and then providing the answer.
Good. Yes. Go ahead, Ruben. Do you want me to summarize the question as well?
Yes, please. Yes, please.
Okay. So the question is that when you go to the groceries and buy the groceries or vegetables and bring home, what kind of cleanness or what kind of cleaning process you should do? That's the question. So the answer will be, obviously, you have to be careful. On the other hand, you have to use your common sense as well. So if you buy the packets of fruits, which is already packed up in a polythene bag, just come and wash it in the warm water. That will be fine. Number two, instead of buying some fresh vegetables at this time, a frozen vegetable will be strongly recommended because in the freezing temperature, the virus cannot survive. So that is something recommended. Third one is when you bring all the groceries to your home, how do I clean it up? Simple thing is that you can buy an anti-infective wipe like Clorox, which is very common in North America, and just simply clean the bags, clean the outer surface, and then you can take the groceries into your house. You have to be careful. You don't want to use any strong chemicals because instead of getting the illness from the virus, you don't want to fall ill from the chemicals, right? So simple wiping should be good enough. And the third one, keep it in your mind, even though your vegetables come in, once you cook in a heat temperature, The virus cannot survive there. The virus cannot live in the extreme cold weather as well as in the hot weather. So the summarized answer will be just clean up with the simple Clorox wipes, bring the stuff inside, tuck it up, you should be fine.
Thank you so much. One more question though. So you said that use warm water. So you're saying warm water will be enough?
It is basically to clean up the outer surface of the packed fruit. Say for an example, you buy a bag of apples, right? We are talking about if anything is packed in a polythene or bag, then just washing up in a nice warm water that should be good enough.
Oh, okay. Okay. Thank you so much.
You are quite welcome.
So I have a question, Dr. Raguraj.
Hello.
Yeah, hi, Dr. Raguraj. This is Amir.
Oh, hello, Amir.
Hi, good. I mean, I've been listening to all your conversation, very informative, and I'm very thankful that you come online and give us all this information. I have a quick question, which
yes,
I've
Amir, go ahead.
asked quite a few times, so I don't know how to answer that question sometime. So the question is, how do you feel about passive immunization, like just like the plasma therapy, when the people who are recovered and try to use the antibodies for the people who are infected?
Right. Okay. So I'm going to quickly summarize the question, Amir, again. So the question is, among the treatment options available at this time, what is your opinion on the plasma therapy? That is drawing the blood from the infected person and giving to the person who has recovered from the COVID-19 virus and giving to the patients who are sick. The answer is it might work because it has shown on various options of treatment there is a consistent and best response for this plasma therapy. But again, look into the numbers. Some of these data are not very clear for us from China, but looking into the data from Europe, mainly from Italy and Spain, when they look into the antibodies, which is produced by your own body against the infection, only 70% of the patients, they had a successful or adequate antibody production. 20% had a mild response. About 5 to 10% didn't have any antibodies at all. So it's a very much investigational product, but definitely we can try. We are desperate. So I think the patients who are on the ventilators, this might be an option to consider. But a lot of unknowns about this virus because it's a brand new virus. Known is very less, unknown is huge. So, but that is something definitely we can try, and it is being tried in various parts of the world as well. Hello?
Great. Thank you, Raghunath. Can you hear me? So just one suggestions to the participants in the considering the scenario of the audio. Once you ask your question, if you could mute yourself, that would be great. Otherwise, we will hear some background noise and echoing as well. So once your question is being asked, please mute yourself. Go ahead. Somebody had a question, right?
Dr.
Hello?
Raghu, this is Lanka. Yeah, this is Lanka.
Oh, hi. Hi, Lanka.
How are you? Thank you for doing this. I just have a question because one of my friend, he's pretty old, like a 70-some years old. He's a Sri Lankan guy. So he's in the hospital right now. He has the virus, but he's not fully recovered, but he has pneumonia, but they are sending him home like tomorrow. And they told him to like recover from home. What can I tell the wife? Because it doesn't sound like it's the right thing to do.
Right. So the question is that elderly gentleman who was diagnosed with the COVID-19 virus and subsequently who has suffered from pneumonia, he has been treated in the hospital and he is being discharged. So the concern is what are the precautions the wife or the family has to take it. So the answer will be, even though the hospitals are overcrowded, they are working in a crisis mode, when the patient is ready to discharge, that means they have almost made sure that his infectivity stage is not there. That means highly unlikely any of the family members are going to get the virus from him. But saying that, usually the 14 days is a period of time what we give it from the time patient has been diagnosed. After 14 days, usually he is no more infected. So my guess is that his pneumonia is resolving. Basically, they check the oxygen level in your fingertip. Oxygen level is coming up. But saying that when he comes home, probably for the next 3 days, I would recommend that he to be alone in the room and to be monitored. And after 3 days, he should be back to his normal self, and the family can consider him that he is no more infected.
Thank you. I will tell the wife. Thank you so much.
You're quite welcome.
Just to piggyback on that question, or based on the answer, would the patient has to be kept for 14 days as well, like quarantine, or after coming home after a few days, he will be able to resume duties as normal?
Yes, you don't need to go back to the 14 days. The 14 days is from the beginning. So that 14 days, I'm quite sure that 7 or 10 or 12 days would have gone now. The 3 days period is just to make sure that he doesn't get the fever. If he doesn't get fever, most likely he can be considered to be he can't give this infection to others in the family.
But he still has the fever. That's the thing. And the wife is
okay.
He still has the fever.
Yeah, probably like any other pneumonia, then he has to be monitored at home. I don't think you have to take too much of isolation process there. Just to keep an eye on him. If he feels sick, if he is becoming again short of breath, obviously he has to be checked up by a doctor. But if he is, as long as he is recovering, I think the family should be able to consider him to be a non-infective person.
Great. So we have another question on the chat line. It comes from Ratna Muralidharan, and the question is, even a vaccine is found and ready, how long it would take to make it available at my doctor's office?
Right. It's a good question. First of all, the vaccine itself, as I mentioned earlier, it is going to take a while, right? So because one is, they have to produce the first the virus vaccine has to be produced, it has to be checked in the animals, then it has to be checked on the humans, then finally you have to make sure that it is safe and effective. So to all this process, it's not the dollars and cents, it is a matter of physics and the time what is required to develop a new vaccine. So first of all, as I mentioned earlier, the earliest vaccine we are expecting, even though 80 odd companies are working around the world, University of Oxford is expected to come out with the first vaccine that might be in the early fall. And we hope that if it is successful, and they might be able to produce at least 1 million doses, because then the question comes, how many vaccine products they can make it at a time, right? So this particular company is starting a human trial next week in England, and it is too soon to know whether it will be safe or effective. So talking about getting at your family doctor's office, it is a long shot. I am expecting that one might be not in until 2021. So in 2020, probably by end of the year or in the mid or late fall, we might have a vaccine available, but that doesn't guarantee that all of us who need this vaccine, we might be able to get it. So, but look at a positive side. When we had the outbreak of SARS, that was in 2003, it took about 20 months to develop the vaccine. Then in following 2015, when we had the Zika outbreak, it took about only 6 to 9 months to produce the vaccine. So with the advancement of the genomics and the science, the timeline is being cut down further and further. That is a very positive, encouraging sign. So sit tight. Let's see that what happens in the fall, then we'll move from there.
Great. Thank you. Any other questions? All right. So, and I think we're going to be, we can also talk to them about the collecting the mails and bringing it in.
The basic daily routine things, right? So that's a good point, Ruben. Yeah. So for the listeners, I think earlier already we have addressed how to handle the shopping groceries, and when you bring it home, what kind of cleaning you have to do it. Second one is about your clothing. Sometimes, even though at the moment essential services are going out, but there are a lot of people, we have to go to work every day, we have to come back home. So the recommendation will be that when you come home, if possible, try to take all your clothes off in the garage and put it in the washer. Then you can go and take a shower, get back into the home. Basic hygiene. And when you put the clothes in a washer, people, they ask, do I have to clean the washer? Do I have to clean the dryer? No, you don't need to, because it's a heat and it's a hot water in the washer, and it's a heat which is drying your clothes. In that hot water and the heat, virus cannot survive. So once you put your clothes into the washer and dryer, take it out, you are fine to wear it again. That is number 2. Number 3, as Ruben mentioned about the mail. I mean, we don't have a clear-cut answer because it's a new virus, but simple common sense is that if the mail is delivered in the box, I would recommend leave it there for 24 hours. Because according to the UNICEF, what they say is this virus cannot survive in a fabric or paper surface more than 12 to 16 hours. So I think leaving the mail for a day and picking up on the next day might be an ideal recommendation. But this is all we are using from the some of these early reports we are getting it from. Nobody knows exactly how long this virus will survive on which surface. But UNICEF is fairly accurate. So that would be the recommendation to picking up the mail. So we discussed about the groceries, we talked about the clothes, then we went up to the mail. Anything else, Ruben, you could think about?
How about shoes? I read an article about, is there a chance that the virus could travel inside the house via the shoes or,
footwear, yes. So footwear or shoe, I don't think you have to clean up every day. As long as you leave it outside the home and you put your socks to the washing, I think that should be perfectly clear. That should be fine.
Right. I think as Sri Lankans, we always do that. I mean,
exactly. So right. we have to go back to our traditional ways of doing things.
Right. Right. So, any other questions, anyone that we could address at this point? So, looking far back. So let's say we are, it all started in February. Now it's in April. We're hoping things may change a bit in May. There was a belief at some point saying that when the sun comes out and the summer hits out here, it's going to go away. Is that a true statement, Raghu?
Yes, partly true, Ruben, because again, as a new virus, nobody knows. But by and large, the virologists, they believe this particular coronavirus, looking into that, like SARS belongs to the same family, coronavirus, and this is COVID-19. The coronavirus generally has shown that it cannot survive in temperature centigrade or 79 or 80 degrees Fahrenheit. So if we get an early hot spring or early summer, the spread might be limited. I don't think it will kill the virus, but the spread will be very much limited with the warm or hot weather.
Right. Great.
So if nobody is there, let us talk about a few more things as well. People can, I think, understand. Ruben, if anybody comes online, let me know.
Yeah, I have one more question, I guess, from the
Yes, sure. Go ahead.
Hi, Raghu. It looks like some people are showing positive again after being negative. Any comments? That's from Tusit, I guess.
Yes. Yeah. Hi, Tusit. Yes. So as I mentioned earlier, most of the people traditionally looking at our experience and science, when you get a viral infection, even if you remember as a child back home, if you get a chicken pox or a mumps or measles, you are told that you will have a lifelong immunity. It is true for most of the viral infections. So that applies for COVID-19 as well. But again, the surprising part is we are not able to make out scientifically what is this 10 to 15% of the patients not developing either no antibodies or adequate antibodies. But again, some of the data coming from China, we are not sure how accurate they are as well. But I think in the coming months, we'll have more data which we can trust it from Europe, mainly from Italy and Spain. So at this time, with the information available, we can confidently say that most of the people are unlikely to get a second infection from the same COVID-19 virus.
Okay. So in terms, so you touched on the hygiene, you touched on the day-to-day routine. How about, so we all are stuck inside the house having 3 meals a day, and how should we be mindful in terms of what do we eat, how do we manage our day-to-day routine, and doing at least some sort of a minimum level exercise in order to make sure that everything that consumed gets burnt out, and then we don't end up with something else apart from the virus.
Sure, that's a good question, because all of us are basically stuck at home, and we don't want to go suffering from either mental illness or physical illness due to inactivity. So number one, as far as the mental health is concerned, let us be positive. Let us be optimistic. But the simple fact is, pandemic is not a hurricane or a wildfire, and this will clear. And already we are seeing some early symptoms from the current epidemic hot center in New York. The curve is flattening. The number of admissions are coming down. The number of people who are being discharged is coming down. But death is still a worrisome part, but that is going to go on because of the elderly population and the patients with underlying economic. So first of all, you have to be very positive, optimistic, number one. Number two, don't allow the stress get into your system. Because when you are stressed out, your immunity level goes down. When your immunity level goes down, you are highly vulnerable for any infection. So be strong and positive. That is very important. Third one, keep your mind occupied. For an example, you can catch up with what you are not able to do in the past. Probably reading, watching movies, talk to your friends. You can have a video conferencing. You have got so many devices. You have got FaceTime. You have got WhatsApp. You have got Zoom. So you can catch up with all the friends. This is the ideal time to catch up with them. And finally, you have to be active as well. But keep it in your mind when you step out of your door, the physical distance is very important. So when you walk on the road or go to the park, make sure that you keep a 6 feet distance. Walk about 30 minutes every day when the weather is nice. It's good to breathe the fresh air, go out of the house. So these are the things I will recommend. And when you come back at home, as Ruben mentioned, there are so many things online on YouTube, simple basic exercises, what you can do at home. You don't need to overdo things, simple basic things.
Sure. One other thing I just read about is due to the current situation, the liquor sales has gone up. So that means consumption of liquor, in other words, alcohol, has gone up as well. How do we manage? We always encourage moderate consumption, but what would be the drive? What would be that line, and how mindful we should be in terms of consumption of alcohol?
Yeah, that's also a good question. And yes, unfortunately, all over the world, the data is showing that alcohol consumption has gone up because a couple of reasons. One is you are living in a fear, and that gives you a false sense of feeling good when you take an alcohol or when you have something to consume. Second one is you are lonely. So I think that patients, if you can break that, not to feel lonely, not to have in the mind, that itself will set your mindset not to consume alcohol. And like any other normal senses, under the normal circumstances, whatever the normal amount, whatever you are comfortable, a small, moderate amount once in a way might be acceptable. But beyond that, you have to be very careful that you don't want to get too much of alcohol consumed and get into trouble from alcohol consumption. And I know that some of my patients are telling me that, doctor, online I saw that some alcohol bringing it might clear the virus from the throat. I don't have any scientific evidence to say that.
Right. Someone was telling me yesterday, instead of whiskey, vodka would kill the virus.
Yes, different kind of, all kind of, messages are going on in the FaceTime and social network. People get confused. Sometimes people, they think that whether it's true, but we don't have any evidence to say that.
Right. So I have another question from another listener, Bindu Weerakon. What is the effect on wearing a non-medical mask in terms of getting affected? Heard that have an effect that stop the spread of droplets. So it's
right.
Like the non-medical mask versus the medical mask. What would be the overall usage of them?
Right. So that's also another good question. People are really confused, right? Because the general information is have clothing around your face. That's how they say. They don't clearly tell you what is the best, what is not the best. Simply a face covering. So let's see that. So I think at the moment, especially in North America, I think Canada or US, or even for that matter in Europe, the medically recommended, or what you call the PPE, is still very much in shortage. Things are getting better. The surgical masks are getting frequently available. So I think if somebody can get hold of a regular mask, or surgical mask they call it, that's fine. If not, you don't need to worry about that. You don't need to spend your time and money getting worried about this N95. That is not for an ordinary person. You don't need that. So the whole purpose of wearing a mask is, number one, if you are a asymptomatic carrier, that means that you do have got the COVID-19, but you don't have the symptoms. Why? That's how it is. Another encouraging news is, if you look at the statistics and numbers all around the world, 80% of the people were having mild symptoms. 80%. So that is a very encouraging. 15% of the patients, they might have to be admitted in the hospital. And out of that, 5% needs a ventilator. So you might be one of those 80%, might be, you might have a once in a way, a small headache, mild fever, couple of days, you think that it is virus and you are fine. That is perfectly good. So when you are asymptomatic, we call as a carrier, your virus is in the body, but you are not sick. When you sneeze or when you cough, you are going to allow the virus to get out of your body. So to prevent that, wearing a mask is basically you are helping the spread of the virus to the others in the community. So if we can get hold of a surgical mask, well and good. If not, a simple face covering is good. People are coming out with multiple innovative ideas. It can be a bandana or it can be a scarf. As long as you cover your face and you don't allow your sneeze or the cough droplets to get out of your body, that will be pretty good.
Great, thank you. Thank you, Bindu, for that question.
I have a question I need to ask. This is Amir.
Yes, Amir, go ahead.
Yeah, Dr. Raghu. So in Maryland, the governor just announced that everybody has to wear the mask. So my question is it just because, do we think, is it now like the theories which are coming out in the same reference? Is it a droplet or they're thinking more of like airborne? What do you think about it?
Yes, that is a very good question, Amir. And as I told you earlier, this is a brand new virus. So the virologists have got only limited information. Every day we are getting more and more information. So up to date, most of the virologists or scientists, they feel it's a droplet spread. So that means basically when you cough or sneeze, the virus goes, millions of virus goes with your droplet, stays on the surface. When another person comes and touches, that goes into their hand. If at all they take their hand and touch their face, virus get into your body through mouth, nose, and ear. So this is by and large generally believed. But saying that, for an example, if somebody comes and sneezes or cough very close to your face or surface, there is a small possibility, I think, air transmission can be possible as well. So that is possible, but by and large, I think that at the moment we have to prevent the droplets, the communication spread is prevented by droplets. So if you take Maryland, yes, he mentioned, I think Governor last week, he mentioned that, he didn't mention the word masking, but he said that facial covering, especially when you go for a retail establishment or in a public transportation, I think it will be strongly recommended everybody wear a facial covering. And it can be a cloth covering as well, because not in our side, not in our county, I mean, where we live, still in lots of different parts of US and Canada, there is the critical supplies are very much in shortage, and they are reserved for the first responders and other frontline healthcare workers. So if you can avoid even buying a surgical mask and cover yourself, that is still recommended. But the answer to your question is, it is strongly believed that droplets is the only form of transmission at this time.
Thank you, Dr. Raghu.
You are quite welcome.
So just to piggyback on that explanation, Tusit has a question in terms of this is his question: micro droplets that can travel more than 6 feet, for example, that are generated while speaking. Example: more fresh air in your homes.
So what is the question again, Ruben?
I think the question is when you have micro droplets, which so the first question is, can the micro droplets travel more than 6 feet?
Right. So I know that various labs have come out with various numbers on this distance of the droplets can travel, but by and large, I think it is believed that 6 feet is a safe distance. But I know that some of the labs in US have demonstrated it can go up to 14 feet. But I think that if you take the common sense and what is being practiced in other part of the world, and where they have successfully brought it under control with the social distancing and keeping the distance, I think 6 feet is good enough. Okay.
So I think that I hope to see that answered your question. If not, please let me know. So Shiroma Weerasinghe has this question in terms of, if someone is infected but not having any symptoms, since that person has antibodies, can this person transmit the virus to others?
Yes, possibly. The way this is how it works. So let us assume that that particular person is infected with the COVID-19. Fortunately, his immune system is very high, and not only that, as I mentioned, 80% of the people, they show very mild symptoms. So your immunity is very high. you don't get the real full blown up virus infection, and you are carrying the virus. And when do you get the antibodies? When your immunity is high, obviously the antibodies are produced in your body. And antibody testing is just coming into US. It was just approved last week. It is still very much in scarce. But if you can get your antibodies checked, that means that you are not going to get the virus infection again. That's how the antibody says. But as far as giving the infection to others, 14 days from the first day of your symptoms, because we are not talking about the virus here because it was not tested, but or tested. From the first day of the infection, for the first 14 days, patient has to be in isolation. After the 14 days, I will recommend the patient to be still in self-isolation for 3 more days to make sure that patient doesn't have any fever or any other major symptoms. After the 17 days, with the positive antibody, patient can get into the community believing that he won't give this infection to others.
Great. So the other question is from Ratna Muralidharan, and her question is, what will happen once this lockdown relaxed a bit? Will there be increased change of another wave that cause another lockdown?
Well, that's a good question as well. Our options are very much limited, right? So let us assume that when things all get back to normal, everyone wants to know when this will end. But I think that we may have to think in a different way. This is not the right way of thinking. The right question is, how do we continue to maintain our safety level? So probably I think the entire lifestyle is going to change all over the world. And we don't know what are the impacts. One is economy, other one is the social health, mental health. So all these things put together, I think at this time we don't have an answer for all those unknown factors. So be positive, be optimistic, take care of yourself, be happy, keep your stress level down. Let us assume that everything will get better.
Great. So the other question is from Bindu Veerakon. Everyone talking about the hydrochlorine as a medication. Where are we with that in terms of testing? Can that help until we get the vaccine?
That's a good question as well, because the ultimate treatment is either when we have a successful treatment or a successful vaccine. Until then, we don't have any successful treatment for that. So let us look into these drugs which they are talking about, including the president of USA. He has been talking about this hydroxychloroquine. It's a fundamental drug which is used for malaria in our part of the world, and in the western part, very commonly used for autoimmune diseases, something like rheumatoid arthritis or lupus. But one thing so far we know that from all the studies it has been done so far, this doesn't treat the disease. How do you know that? There is something called viral load. What is viral load? The amount of millions of virus in your body. So when you take a tablet or a treatment, the viral load, they say for an example, from 10 million, we should be able to see the viral load coming down to 1 million or 50,000 or undetectable. It is not happening with hydroxychloroquine. It is not. So this is all very much, as I told you, that is an experimental drug. So many drugs are being tried in various parts of the world. And keep it in your mind, this is not a medication to be taken as an outpatient. This medication can be used safely only when you are admitted in a hospital setting. And currently, if you look at China, Europe, or North America, they are only using in the ICU setting. The reason is, if you overdose yourself, that means if you take more than what your body can handle, it can cause irregular fast heartbeat and cause cardiac arrest as well. So one is, this medicine doesn't treat the condition at this time. This medicine should not be taken as an outpatient. We have to wait and see what can be done. So the fact of the matter is, we don't have anything to say to the patients, there is a protective medicine, preventive medicine, no. But only thing we have found out then is, if you keep your vitamin C level and the vitamin D, C and D, unfortunately the D level is very much low among the Asians in all over the world for a couple of reasons. Number one, I think we don't go out enough in the sun. As we know that the basic science is the skin makes your vitamin D. We don't go out enough in the sun. So due to that, most of the Asians have got low vitamin D. And vitamin C, if you can take over the counter, not to overdose, just over the counter. That means the recommended dose will be 1000 milligrams of vitamin C and 2000 units of vitamin D every day might give you some protection. It doesn't boost your immunity. There is nothing called increase your immunity. It is basically give you some protection from the viral infections.
Great. So Tusit has another question. Again, it's related to the micro droplets. Some are encouraging to have good air circulation in your homes. For example, open windows whenever possible. I think his question is that going to help in terms of
Yes. So let us look at this way. So we are talking about the droplet when the patient is infected. So when a person is infected, say a patient for some reason he couldn't be tested, there is a shortage of testing supply, but he might have the symptoms. You call the doctor says, well, you are going to be on self-isolation. When you're in isolation, you are going to be in the room. And I don't think opening the windows are best idea at that time. Put you on a self-isolation and stay inside the room for 14 days. Normal person, day-to-day life, if you want to open the windows, that's fine. If you want to get the natural light to get into the house, that's fine. You want to leave the open door for to get some fresh air, that's perfectly fine when you are not infected. So the micro droplets doesn't come into an ordinary person's life unless otherwise he is confirmed by COVID-19 testing or there is a clinical suspicion by his family doctor who will basically recommend that if you are not allowed to have the testing or not able to have the testing, put you on self-isolation. I hope I answered this question, Tusit.
Great. So that being said, just a quick time check. It's 4 o'clock on Sunday afternoon. We are going to be here for another 1 hour. So do you have any other questions that we could take at this point? Or any clarification based on the information that you've heard from the local news or from social media?
And one more thing we can mention, Ruben, for these listeners on this conference call is language should not be a barrier. The moderator is very comfortable. He's a trilingual. He'll be very comfortable of translating even from Sinhalese or Tamil to English.
Absolutely. Thank you, Raghunath. So Monica has a question as what does everyone feel about flying in May?
Flying in May. Answer is I can straight away say that no, please, because the reason is that we are almost coming to the latter part of April, and according to these scientific studies or drafts or whatever they call it, they call us the mathematical model, right? And I think, like for an example, White House is following a mathematical model from the University of Washington. So all the predictions by and large say that we are yet to hit the peak. Probably we are flattening the curve by end of April. For Marylanders, I think it's going to be either today or tomorrow according to the mathematical model. And I think we are going to see the decline of the numbers through the end of month of May. Early June might be having some normalcy. Probably we might see some reopening structures, because lockdown is the last resort when the virus is spreading so rapidly. So it has to be done. But possibly at some point we have to come back to the normal life because economic costs cannot be sustained indefinitely being closed. So travel will open up, but I think definitely May is too early. If anybody has got the plans, unless otherwise it is a very, very important family member in serious condition, or it is unavoidable. Cruise, getting into the ship, getting into the plane, any long travel, I will avoid until the summer.
Great. Thank you. And in terms of food consumption, so as Sri Lankans, as we Sri Lankans, we use a lot of natural ingredients such as garlic, ginger, and other natural supplement, as I call, as part of our cooking or preparation. Does that have any effect in terms of the antibody or in terms of controlling anything that would get into our body?
That's another good question. All the time I get asked from my Asian friends and family members. It is very true, Ruben, that we all consume a lot of things. I am quite convinced that it has got a lot of anti-inflammatory properties. What is infection and inflammation? The difference is, say you get a virus, that is infection. Then that causes all the problem. Then the second stage is it causes inflammation. That's how you get the pneumonia, kidney failures and all. Probably all the spices what we have got part of our normal regular cooking has got anti-inflammatory properties. But again, you have to be very careful, and there are a lot of false and misleading information on the social network. But definitely traditional herbs, I think it helps you on the inflammatory side, but it won't boost the immunity to the virus. That is, we have to be very clear. And sometimes patient ask me, doctor, I heard that somewhere some scientific study says, how about a hot tea? I was told that it might clear the virus from your upper respiratory system. I don't think so. I know that tea has got something called methylxanthine. Methylxanthine basically has got a small antiviral properties that is negligible. It won't help you at all. So going back to the answer, Ruben, I don't think we have to consume excess of spices and all those traditional herbal stuff what we have been eating. Stay with your normal cooking level. I'm quite sure that all of us will have some sort of benefit from our spices what we have been consuming.
Right. And just to piggyback on that, we, as part of our traditional beliefs back home, even here, we do a lot of steam inhaling. So would that help at all?
There is a small benefit on the steam inhalation. So let's see that. So how does it work, right? When you have got a lot of inflammation and congestion in your upper respiratory system, starting from your nose, sinuses, upper respiratory and throat, the steam inhalation basically opens up your respiratory tract and allows you to breathe better. So that's the only benefit it gives you. So it's basically a symptomatic relief. It doesn't kill the virus at all because the temperature, I think, is not sufficient high enough to kill the viruses. So I think that if you are using this normal method of steam inhalation, or you have a big inhalation, just to clear up your upper respiratory, that's fine. But you don't need to overdo things just as a preventive measures. We don't have any scientific evidence that it will benefit you preventing from getting the viral infection.
Great. So there's I think this question you've already answered. The question is, say, if you want to go on a walk outside, do you need a mask?
Yes and no, because if you are keeping a 6 feet distance, you should be okay. But if you have got a mask, no harm, because no harm in wearing. As long as you are comfortable, the mask is clean, I think it's no harm in wearing. On the other hand, if you are just going for a walk, you want to completely, breathe the fresh air and feel good, you can walk without the mask, keeping a 6 feet distance.
Great. And how about for those people who may not have insurance or primary care doctor, or who may not have a medical coverage in the US? What should they do? Or if we come across somebody who may have the unfortunate event of that they don't have an insurance or they don't have a medical coverage, what should they do?
Right. It's a good question, Ruben. Like if you let us look into New York City. Why did it happen? Obviously, it was an early infection, left us with too many cases. That was the fact. But saying that, why did it happen in New York City? It is a big city. It is an overcrowded city. And people, they all live so close to each other. And finally, they don't have affordable, good healthcare system. Most of them might be immigrants. Most of them might not have an insurance, or they might have a high deductible. They don't go and see the doctors. So if you have high blood pressure or diabetes, basically your body immunity is very low. So unfortunately, that is what we are talking about. But under this COVID-19 virus spread, one good thing is in US at the moment, whether you have got insurance or not, COVID-19 testing will be covered. That is number one. Number two, that if you want to go to the hospital, if you feel if there is a genuine condition that you are convinced that you are having short of breath, your temperature is running high, you are getting sick, if you go to the hospital, right from the emergency room up to the admission and to the ICU, everything will be done. But beyond that, the medical bill, there will be a different question to answer down the road. So at this point, whether you have got insurance or not, testing is there. The care for the hospital care is there available for you as well.
So what would be the process be? Just normal routine of calling 911 and then proceeding from there on?
Yes. So first of all, don't get panicky about this COVID-19. I get calls all the time. Doctor, I got a bit of a headache. I got a bit of a fever. I got a bit of a mild sore throat. Do you think so that I have got COVID-19? No. So COVID-19, as we mentioned earlier, it can be symptomatic or asymptomatic. If it is symptomatic, usually you tend to have a high fever, above 103, right from the beginning, day number one. Then you will have a persistent, consistent, troubling cough. Then you have got a very bad, painful sore throat. Then you develop the short of breath and all. So until you develop the short of breath, I think you are okay to stay at home on self-isolation. But once you feel that you are developing short of breath, obviously you have to call the 911 or get a family member to drop you at the emergency room, because Unfortunately, under the current situation, nobody can be there with you. So basically, drop you at the ER, either a family member or call the ambulance if there is no other source of transport for you.
Okay. Mr. Herath, I think you had a question, right? I've unmute yourself, so why don't you go ahead, please?
Yeah, I was asking, what about asafoetida? Using it, they said this asafoetida is really good.
Sorry, what is that? Tell me again, please.
Asafoetida is Indian spices. Is we call.
Asafoetida. Okay, yeah. I am not sure about that, but as I mentioned earlier, so far I have looked into various traditional herbs used mainly in India, Sri Lanka, that part of the world. There is no scientific evidence that it is going to benefit you. And keep it in your mind, these traditional herbs, they won't boost the immunity to your virus. But it might help you to feel better, but it doesn't give you any protection. Because you have to be very careful. You don't want to be in a false sense of security feeling that I am protected from these herbs. Unfortunately, it is not. But if you have been taking that in the past, that's fine. But don't start anything new under this current virus spreading time.
I have another question to ask. What about if I had to get somebody to fix something in the house, plumber or electrician or somebody? What
Right.
kind of situation is there?
Sure, that is a very good question because they are also at the moment they are part of our daily emergency life. They are part of our emergency life as well. So if you have got cleaners, if you can avoid anything what can put on hold, right? We can keep them. We can tell them we don't need that. Whatever can wait, let them wait. But if you have got a leak or if you have got an electric issue which has to be addressed immediately, that's fine. Let the plumber come in. Make sure that he is wearing a mask. Number one. And make sure that he washes his hands. No harm in telling. We are not hurting them. It is for their protection as well as our protection. Wash your hands. Or if you're wearing gloves, that's fine. When you leave home, make sure that you all wash your hands wherever he has touched the surface. Clean up nicely with the antiviral. Either it can be a wipe or it can be any chemicals, whatever you have been using to regular day-to-day cleaning. Clean the surface wherever the contact has been there, and then you should be fine. But I would like to avoid anybody coming into the house except the immediate family members, not to get involved or doing anything at the moment.
And thank you, doctor.
You are quite welcome.
Great. So just to piggyback on the ventilator, in an interview that you had given earlier on, I had the privilege of listening to it. So you spoke about, having a breathing support machine is going to be useful, or how does that work? We always talk about we don't have enough supplies, and now car companies are asked to produce these machines and stuff. So what is the connection between a breathing support machine and how this would be useful in terms of curing a patient?
Right, that's a very good question. Everybody thinks that people are talking about ventilator. What does it do? So let's see that. So the bottom line at the moment is we don't have a treatment for this COVID-19 virus. So as I mentioned earlier, you can be asymptomatic, you can be symptomatic, you can be treated in a regular ward or floor in the hospital. Once your oxygen level started falling down, right, they check it on your fingertips. That is, if it started dropping down, we can see that the gradual pattern. That means you are building up the fluid or pneumonia in your lungs, and if it is not taken care or if it is not treated, the patient will die of not having adequate oxygen. So what are the things they do? Number one, obviously they do the supportive treatment. You hydrate yourself, they put you on the oxygen mask, and managing his fever, keeping the fever down, because fever makes your body to become dehydrated and you lose the fluid from your body. So in addition to the hydration, oxygen, and keeping the fever under control, if the oxygenation level is still falling down, you are hooked up to the ventilator. What does the ventilator do? It is pushing the air into the lungs. It is pushing the air because by your own capacity, you are not able to breathe. So the ventilator basically keeps on pushing the oxygen, and your lungs are getting adequate oxygen. That makes entire body, including the brain, kidney, every organ, to get adequate oxygen with the blood circulation. That's how the ventilator does.
Okay, thank you.
Yep.
So any other questions, anyone?
Another important thing, I think, Ruben, if there is no question, we can. I have come across this one very commonly. It will be interesting to touch as well. If you look at the statistics around the world, if you look at the number of cases who have been infected, who have been diagnosed, who have died, unfortunately, the number of men is very high. So the question comes is, what is the reason that men are being affected more than the women? So before we get in there, we all know that children are most of the time spared. The reason is they get this viral infection throughout the whole year. We know that kids go to the school, come with a running nose. Next day, the kid will come with a cough. That means one after another, their body has been exposed to the virus and they have got enough antibodies in their body. But the adults are different. But I think the reason for the males to have high infection as well as death, I think as males, we produce a weaker immune system and our response is weaker than women, generally speaking. And not only that, countries where people are still smoking, there is a high rate of tobacco consumption among men. And third one is generally the diabetes, hypertension, what we call as underlying medical conditions. They are much more higher in men more than the women. So that's the reason the outcomes are worse, the number is high on the COVID-19 diagnosis.
Okay, all right. And there's a question in terms of so the Tylenol works for fever. Sanjula has asked that question. The question
Right.
is, can I take Tylenol for the fever?
Yes, definitely. So this is also one of the commonly asked because we are very commonly used of using more than Tylenol like Motrin, which is ibuprofen, Aleve, which is naproxen. But at this time, even though we don't have any convincing evidence that it might be not safe enough, general belief among the medical professionals is the ibuprofen, which is Motrin or Aleve, is to be avoided, and Tylenol is perfectly safe to take it for aches and pains as well as for the headache and fever as well. So stay with the Tylenol, but the most important thing is along with the Tylenol, make sure you hydrate your body very well.
Great. Bindu Veerakon has another question. Kids miss the outside junk food. How about getting them delivered? How safe is that? Do I need to reheat after once the food is arrived?
So we are looking into carry out or delivered food to home, right?
That's correct.
So I think the general concept applies. If you are getting, for an example, if we are ordering a pizza, not a bad idea to clean up the box, right? I mean, we have to be careful because, as I told you earlier, we don't want to be affected by the chemical damage more than the virus damage. So use something basic wipes to clean up your pizza box. That is one thing. If the food is delivered in a bag, most of the time it might be a carry-on bag. Yes, take the food outside the bag out of your home, bring the food in. And when the food is warm enough or when you warm it up, the virus is gone. So leave the bag or boxes or anything, whatever has been delivered outside your home. You can get rid of them on the next day. Bring the food inside, warm it up nicely, wash your hands since you have touched the bag, and then you can consume your food safely. You don't need to worry about that. So keep it in mind. We don't want to worry about each and everything in your life because life itself has to be sometimes, has to be very relaxed, easygoing. That's one of those things, one of those ways to handle this virus as well, more than being precautious, washing your hands and all. Try to keep your mind in a relaxed mood.
Right.
Thanks, Dr. Raghu. So, but
I
won't tell them to kids anyway, but yeah, just for my information.
Sure. I mean, feel free to ask any question. We have got enough time as well.
Yeah.
Yeah, so I don't see any other questions on chat, but we'll address it as it's coming. Any other thoughts in terms from the general perspective?
That's what I am looking into. That what else can be giving some useful information to the general public. So physical distancing, I think we talked about that. Economic cost, we know that everybody is going through that, but I don't think we have got an answer. But as I told you, this lockdown it's not going to be there for a long time. Obviously, we have to look into that. At the same time, lockdown will be removed, and probably as long as we are healthy. I tell my patients, when your life is important, because if you live only, you can think about the livelihood. So that is one of those things people have to keep in mind, not to worry too much on the economic part. Obviously, that is part of our life as well. Then finally, we have to understand the only end game will be suppressing the virus until a vaccine can be produced. So even though the lockdown is removed, people they are getting back to normalcy. You are able to go around and do things. Practice the basic things: washing your hands, being watched out, being careful. Those are very very important. And probably my feeling is that it might, this kind of minor viral infection, being careful, we may have to add up for the next 2 years. So those are the basic things. I will repeat it again and again. And apart from that, let the life go on, right? We all have to live. We have to live happily and disease free.
Right. And so just to piggyback on that, so would our new normal going to be, from June or July, and when we go to restaurants, when we go to a movie theater, when we fly, is that going to get changed? For example, currently I know within the US, when they travel, only one passenger is allowed per row. In a movie theater, now movie theaters are closed, but at the beginning they had one viewer per row. And then, in other public areas also there were limitations. So now if I go to Walmart, 2 weeks or 3 weeks ago, I can walk in, walk out of Walmart, no issues. Last week when I went to Walmart, they were yellow taped and only a few number of customers were allowed in, and it's going to get lined up. So is that going to be our new normal after the reopening?
It's also a good question. We don't know, Ruben, because it is basically an unknown virus, and we are living in a very, a period where a lot of unknowns are there. But we know that current situation is so acute and so serious. So when we return back to some normalcy, we don't know how to call and what is normalcy is going to be. Very difficult to say what are the changes we are going to see in our lifestyle. As I mentioned earlier, when you go to a restaurant, how things are going to be. Instead of if the restaurant is having 100 chairs with 10 tables, is it going to be 5 tables with 50 chairs? The distance is going to be high. When you go to the movie theater, I think probably, are we going to have a distance? If the cinema theaters are going to rearrange all the seats. In plane, already it's crowded. That might be good for us. Either are they going to give enough space between passengers? So a lot of unknown questions are there in our mind, but definitely things are there to change. Very difficult to say that how it's going to be. It might be positive way, but all of us are going to adapt to that, and we have to wait and see.
Right. So thank you for that. And in terms of takeout foods, there is a vibe that's going on, at least in here in this part of the world, saying to avoid Asian food, especially Chinese food. In my opinion, I don't agree with that. From the medical perspective, do you think it has anything to do with the current situation?
It is not. You're absolutely right, Ruben. I agree with you. It is very unfortunate that certain section of the population is stereotyped or they are kind of victimized. And this, it doesn't matter. My general recommendation is if you can avoid taking the food from any takeaway for that matter, even buying a coffee in like a Starbucks or anything, avoid. We don't know. Not because of the infection. I would like to avoid anything what we are getting outside the home. Stay with a simple cooking, basic things at home. And if you want to have the food, if you feel of having Chinese, absolutely fine and safe, like any other pizza or any other food what we are getting from the delivery.
Right. And I think I have another comment or question from Sanjula. Do you think drinking hot water with ginger, lemon, and honey works for the sore throat?
For the sore throat, definitely it will work. We don't know the benefits from that against the virus, but some of these historical cities in China where the prevalence or the diagnosis or the number of cases were less, according to the Chinese ancient traditions, a lot of family houses, they have got this tradition of having a glass of warm water with lemon, ginger, and honey before they go to bed. That is a normal tradition. I think a lot of Asian families also, they tend to do that. And they think that it would have given some sort of unexplained protection, but we don't have any scientific evidence. So if you are already doing that, you can continue that. It will definitely help you for the sore throat. We don't know the benefit against the COVID-19, but please do not start anything new at this time, which you haven't done in the past.
So just on that last statement you mentioned, please don't start anything new. There, I know for that underlying message, there is something behind the medical terminology, right? When we go to a doctor, is that part of the treatment process?
Are you talking about, Ruben, about the placebo effect, where it is not, doesn't really help you, but your mind thinks that it's helping you?
When you mentioned don't start anything new,
right.
For example, I may have not seen my doctor for the past 2 months. All of a sudden, my new normal has adapted, and I've changed the way I'm taking medication or adding stuff to my diet. And then something happens, I'm taken back to the doctor, and there is no history in terms of what has changed. And the doctor might find hard to treat me because he may not know what had happened in those 2 months time period.
Exactly, very true, very true. Even though they go through the history and all, yes, I think better to avoid anything which is unknown, which you haven't tried, which you haven't eaten, which you haven't taken in the past. Just stay with your normal day-to-day life, what you have been doing over the years.
Right. Thank you. Any other questions, anyone?
Yes, I have one question.
Yes, Mr. Harat, go ahead.
This is Kuda.
Hi, Kuda.
How are you? I have a question about asking. I have two teenagers. Sometimes they order outside food. So sometimes they order Chipotle or sandwiches or something cold food. So we should avoid this.
This is how it works, Kuda. I mean, ideally, in ideal world is different, real world is different. In an ideal world, yes, ideally we like to avoid anything, any food coming from outside, ideal world, including, as I told you, even getting a coffee from Starbucks. But on a real world, I too have got the kids, I know that. And even though you make the best food at home, still the kids want to have some food outside. It's perfectly fine. Practice the basic hygiene. Number one, as we discussed earlier, when the food is delivered, make sure that bags, container, everything is thrown out. If it is, for an example, from Chipotle, you have got the container at the bottom. Just clean up with a simple wipe, including the aluminum cover on that. And the food is warm enough. Make sure that if you can warm it up a bit more, just to protect yourself, wash your hands, have your food. I think it should be fine.
Yeah, I have another question, doctor. I have arthritis. Doctors, my doctor says so. Sometimes they give me ibuprofen 800 milligrams to take for my pain. So they said take one tablet by mouth every 6 hours, but I won't do that. I take maybe like once a day or something like that. So that's going to be helpful.
Yes. So the answer for the question, Guda, is earlier we mentioned if you are diagnosed with COVID-19, only if you are diagnosed with COVID-19, then ideally we tend to avoid the ibuprofen and Motrin or any other anti-inflammatory. Since you don't have the virus, you are absolutely fine to take the ibuprofen 800 milligrams. Like any other medicine, you can start with one tablet once a day. Maximum, you can go up to 800 milligrams 3 times a day if needed on a bad day. So at this moment, you are fine to take the ibuprofen.
Thank you, doctor.
You are quite welcome.
Great. So I have another question here. I think you've answered this already, but let me repeat it one more time. Do you think washing veggie and soap will wipe the virus from veggie and the fruit?
Yeah, so as we mentioned earlier, the answer, probably some other listeners might be coming a bit late to this conference. Answer is yes. So most of the washing systems and the dryer system are based on heat. So the heat in the hot water in the washer and the heat in the dryer will definitely kill the virus. You don't need to do any chemicals at all. You don't need to even use the bleach for that. Your regular clothes, when you come back from work, put it in the washer, put it in the dryer. You are safe to take it back and wear it on.
The question was more like on the vegetables, like vegetable.
Oh, vegetables. Sorry, I thought about the clothes. Vegetables, yeah, it's very difficult to say that. Somebody asked me that, doctor, if I like leeks, if I buy leeks, what should I do? I said, consider this one. You are living under the war time. Avoid the leeks and go with the frozen food. You can buy lady's finger. You can buy okra. Everything you can buy. I suppose that only leeks and brinjals. These are the two things that you don't get it in frozen pack, I think. So the basic things, come and wash your vegetables, leave it there for drying for a day, then you can eat it. But as we mentioned earlier, I personally feel that at this time, if you want to buy the vegetables, avoid the fresh vegetables, stay with the frozen vegetables. That might be a better option for you.
Great, thank you. Mr. Unni, do you have a question?
Yeah, hello Raghu.
Hello, Unni. Lot of familiar voices today. Good to hear that.
Yeah, so that was a very impressive presentation. I should really admire that. I just
Thank you very much.
One small input. What is your take on it? May be medically a little bit advanced for the ordinary listeners, but it's a common question I come across. Because it has been tied, the COVID has been tied to antiphospholipids, and there is some pulmonary embolism. There is some benefit of low dose aspirin, 81 milligrams. So have you any thoughts on that, Raghu?
I don't have any information only, but so far looking into all the complications. So very commonly, as we all know, that when we get the COVID-19, it basically destroys all the cilia in your respiratory tract. That's what you are developing the fluid or pneumonia in the lungs. Then, because of the lack of oxygen, they are seeing that kidney failure is one of the commonest things that is happening. They say that about 1/3 of the patient who are on ventilator, they need a dialysis, temporary dialysis as well. Then it comes to the heart, basically some myocarditis and heart failure is happening. And there are few cases of encephalitis, which is the infection of the brain happening. I haven't come across only the COVID-19 contributing for the pulmonary embolism at this time, but I think, I suppose, taking an 81 milligram baby aspirin, anyway, it's protective for all of us, right?
Right.
Yeah. So, but again, the benefit of aspirin against the pulmonary embolism also will be questionable, whether it really benefit against that. But if you are taking the baby aspirin, I will continue that. And more and more information is coming up about the complication. Might be pulmonary embolism, might be one of them. We haven't seen that commonly happening in the death or the patients who are seriously ill in the ICUs in Europe as well as in North America.
Okay. Thanks, Raghu. Thanks.
Oh, you're quite welcome.
Thank you.
Any other questions, anyone? All right.
So probably we'll summarize and wrap it up. Ruben, Roy, what do you all think?
Yeah, I think Roy, what do you think? I think he's on mute. Let me unmute everyone for.
Okay. Yeah, let us unmute and we open up. Anybody has got any questions?
Yes, doctor. This is Kuda again. I have a question.
Yes, Kuda. Go ahead.
I want to ask, what about if we buy the fresh fruit to eat, apple or mango, banana or something? It's going to be other people touching in the store, so it's going to contaminate with the bacteria.
Yeah, definitely, Roy. So a couple of things you can do that. This is again common sense. There is no science or medicine in that. I recommend my patient that if you can get up early in the morning, on a Monday morning at 6 o'clock when the grocery stores are opening up, that's a good time to do the shopping for a couple of reasons. One is all the shelves are stacked up. Second one, contamination is very less, right? But saying that, a lot of people, that we have got a habit of taking the apple, peeling it, then putting it back. Let us assume that the particular person who was in front of you who touched the apple is asymptomatic COVID-19 positive. That means patient has got an infection, but patient doesn't have any symptoms. Obviously, there is a possibility the virus can be in the apple or pears or mango or any other fruits. So if you buy that, couple of things make sure when you leave, before you leave the grocery stores, go to the restroom, wash your hands with soap, number one. Number two, when you bring the fruits, wash it thoroughly with the normal, regular running water. I think that should be good enough to protect yourself from the contamination or from the bacteria, from the virus infection.
Okay, thank you, doctor.
Yeah, you are quite welcome.
I'm gonna, so now everyone is unmuted.
Roy?
Hello? Yeah.
Yes, Roy. It's about 4:30. I think we have answered most of the questions from us. Shall we keep it open or what do you think?
I think we answered a lot of questions. I know we must be tired too, you and Ruben. So
no. We are fine. Roy, we are fine to go. And Ruben, we are good up to 5, right?
Yeah, we're good to go to 5.
Yeah, we are fine, Roy. Don't worry about that. What do you feel that? Is it still, do you think so worth enough to keep it open for 30 minutes or we'll just summarize some highlights, giving some positive messages to everybody and wrap it up?
Yeah, just summarize and highlight it. Yeah.
All right. So for all the listeners, I think we are coming to the end of the conference today. So basic message is stay positive, stay optimistic. The case count and the death rates are falling down all over the world, including in our country and our state and our city. So most important thing is stay with your basic preventive measures. That is very important. Keep your mind in a relaxed mode, happy and relaxed. Don't allow the stress to get into your system. And everything will get better soon, and we will come back to our normal life, and all of us will meet each other and say hello and handshake probably in the next couple of months. So with that, I like to close the evening. I'll leave it to moderator and the organizers to wrap it up.
Thank you,
thank you very much, Raghu.
Thank you, Dr. Raghu.
Hi, Doctor. I have a question.
Yeah. Hold on for a minute. The moderator, there's a listener with a question. Please go ahead.
Okay. I usually go to work by metro. So, what kind of precautions should I take?
Right. So, metro, obviously, public transport is one of the places where you have got high rates of being exposed. Unfortunately, the real life is such a way that we have to take the public transport or metro. So, Steve,
there are few people.
Right. That is very good. Yeah. So, having very few people in your carriage or in your metro compartment is very good. So stay with the basic, simple preventive measures. Make sure that you travel with a mask. This is basically to not only to protect you, it's just to protect others as well. You don't want to sneeze. Second one, if you touch the surface, obviously you are going to hold the bar or anything. When you get down, if you have got a hand sanitizer, clean your hand with the sanitizer. But the best thing is when you go to the workplace, if you can run your hand with the warm water with soap for 20 seconds, please do that every day as soon as you get back to the work. Similarly, when you come back home, don't get worried too much. You should not worry about these things. Just stay with these basic things. When you come home, wash your hands first thing, and then start your. Whatever you want to do, you can start that. So I think you should be okay on traveling in the metro, but do the preventive measures.
Okay. Thank you. Thank you very much, Doctor. I really appreciate it.
You're quite welcome.
Thanks.
Any other questions before?
Yeah, I have one more question, Doctor. This is Kuda.
Sure. Go ahead, Kuda.
What about if somebody want to have some food? If I make it the food and give it to them, I'm a chef. I know how to handle and everything. But
the first thing,
affecting other people.
So your question is, Kuda, if you want to make some food and if you want to
give it to somebody else,
right?
Give it to somebody else.
Right. Yeah. First thing is, can you deliver some food to my house, please?
Yeah.
I am just kidding. I wish I'm living close to your house. It's a bit far away, Kuda. I know that you will do that. Anyway, the answer is, Kuda, yes. Answer is yes. And as I told you earlier, all of us should have our humanity. Sometimes we tend to lose that. We think about myself, my family, my wife, one kid. So look into the neighbors, like number one, always consider that how are your neighbors doing? Are they okay? Can I help you with the groceries? Are you okay with the food? Can I get you some food? Yes, if you want to give it, make the food in a container, leave it out in their doorstep. They can always consume that. That's perfectly fine. Third one, always remember, there is a back home people as well, especially with the curfew and all in Sri Lanka. A lot of day wage earners, who make the money on daily working, they are suffering and struggling. So wherever the village, town or district where we come from, giving a small help back home with some organization who is doing it, that will make us feel good. So food is also, giving the food is good, but at the same time, please pass a message to all your friends. Why don't you do something back home for your village or town, wherever you come from? Small scale, providing a meal 3 times one day. That itself is a huge help.
Thank you, Doctor.
You're quite welcome.
Yeah, hi, Dr. Raghu. I'm also there.
Yes, hi.
Yeah, earlier that Chinese, they said it can contaminate with through the eyes. Is that correct, or is that false?
So far this issue, once we discuss, according to the evidence available, evidence is basically the scientific evidence we are talking about. It is only by the droplets as long as it is not closer to you. For an example, if somebody comes right on your face and sneezes or cough, obviously the infection is going to get into your body. You are absolutely right. The mode of entry is mouth, eyes, and your nose. These are the 3 places the virus is entering into your body, not through the skin. So keep it in your mind. If something touches your skin, nothing happens. But what happens when you touch the skin, and if you touch your face, touching your eyes, nose, the virus gets into your body, right?
Yeah.
So as long as you are keeping a distance and from away, the air transmission is not very clear. Droplet transmission is there. So as long as it is not closer to your nose, eyes, or mouth, you are perfectly safe.
All right. Thank you very much, Dr. Raghu.
You are quite welcome.
So one final, any other final questions before we wrap up for today? So thank you everyone. I mean, the purpose of this session was to share information and to clarify questions that you may have based on what you have heard. I hope we have covered what we've anticipated on this session. Roy, thank you very much for organizing this on behalf of our community here in the Washington metropolitan area. Raghuana, thank you very much for your time and what you and the organization does for the community here.
And it was a real pleasure to work with Ruben as a moderator and Roy and basically Damit as coordinating and taking this effort. Roy, keep up the good job, and always we are available for any help, whatever you need to do the community.
Great. So that being said, it's a Sunday evening, so we'll give you half an hour time back on your calendar to do whatever you need to do. Hopefully we'll do this on a continuous basis, and stay tuned for the next session if you're available. It all depends on what we plan for next week. I have a feeling that we're going to continue this on an ongoing basis. If so, we will definitely inform you. For now, thank you and goodbye.
Bye-bye.
Bye-bye. Thank you.
Thank you.